Okay, so for some treatment stroke options for the lower arm, you would first go through your whole basic arm massage that you already know, your effleurage, your petrissage strokes for the lower arm, some friction as well. After it's nice and warmed up in the lower arm, you can start to apply some deeper strokes to treat this area. So first of all, we're going to use our shingle strokes with a soft fist, but instead of going at more of a moderate pace, we're going to really start to slow it down. So I'm going to make sure my body mechanics are lined up, a nice straight wrist, straight elbow, all the way up to my shoulder, and my fingers are relaxed here. I'm in a lunge stance, and I can just start to apply a little bit more pressure to this stroke and go a little slower as I work my way up the arm here. So not a new stroke for you, just applying it with a little more pressure, a little slower, so that it starts to really sink into the musculature here. And of course, with all of your treatment strokes, anytime you're going deeper, you want to check in with your client and see something along the lines of, Taylor, do you want any more or less pressure with this stroke here? Okay, so my client's confirmed this is a comfortable pressure for her. So using a soft fist here with some progressive pressure can be a way to start to treat an area. Another stroke we can add in here would be our forearm. So for a forearm stroke here, I'm going to turn my inner arm so that my hand is in front of my stomach, and I'm going to use the fleshy part of my forearm, not the pointy part of my elbow here. So I'm going to get in a deeper lunge and start to sink in with that fleshy part of my forearm just above the wrist, and I'm going to propel myself forward by just pushing off of my back foot. I want to keep my elbow and my shoulder in line as I come up through the length of the forearm here. And for these strokes on the forearm, we can cross over that elbow joint since the muscles of the forearm, those extensors, attach just above the elbow joint there. And then I'm just going to lightly glide off to the side, and I can slide back down with an effleurage. So basic sliding effleurage in between your strokes is nice. Here again with a forearm stroke, I'm just going to keep my hand relaxed and make sure my body weight is what I'm using here rather than arm strength to come up through the forearm. This hand is just for support here, or it could be on my knee or supporting on the side of the table. Either way. So that's another treatment stroke for the forearm. Last but not least, we can do stripping effleurage here. So to apply that, I'm going to use reinforced fingertips where my knuckles stay nice and straight line all the way up to my shoulder, and I'll use my other hand to support right on top. Then I can sink in just between the two bones of the forearm with a more pointed pressure. So this is the last stroke I would use, and we can just slowly come up through the muscles of the forearm here. Again, you can always check in with your client to see if they need any more or less pressure. We never want to be applying more pressure than what is comfortable for them. When I get up past those attachment sites, I just gently come out of that pressure and slide back down with an effleurage. I could repeat that stroke a couple of times, 2 to 3 times would be the maximum we want to do in any one spot. And then you could apply the stripping effleurage a little bit more medial or more lateral. So those are the 3 treatment strokes on this side of the forearm. You could do the same thing for the flexor side of the forearm as well, as long as your client's forearm is supported on the table here. If their arm is really far off the table, we don't want to apply any pressure outside there. If you need a little more space, you can always ask your client to move over on the table, but then we would apply the same 3 strokes here. The soft fist. Of course, we want to be careful with this antecubital space. We don't want to apply any pressure in there, so I'm just gently coming off the body before I get there. That's a soft fist. You can do your forearm stroke as well. Just be aware of where your body is and where your client's hand is. So maybe stepping out to the side a little bit more for the forearm stroke here. And last but not least, your final stroke here, you could apply some stripping effleurage as well. Again, not doing deep pressure along the wrist and not doing deep pressure at the antecubital space, but all that musculature in between, you can apply your stripping effleurage strokes there. And those would be your treatment strokes for the forearm.